Hello and welcome to this week's module on population and public health. I'm throwing public health in there and that those terms are sometimes used interchangeably. They are a little bit different and we're going to talk about that. Your text does not really have a lot on public health. They do a good job on care of the vulnerable and special populations, and we'll be talking about that topic in a couple of weeks. So that's why I decided to record this, just to give an overview of things that you may already know, but just to do a little review about what is population health and the services that we include in that. So population health is actually a term that is widely used in the healthcare world, but it's not always universally understood, or it's not, or quite often we're not using a common definition, I think, particularly across different healthcare professions. It first came about from Kindig and Stoddard, and this is their definition: the health outcome of a group of individuals, including the distribution of such outcomes within the group. So really looking at healthcare outcomes across a specific population of people, and then also what are the distribution of outcomes across that population. And of course now, as we look at healthcare disparities and so forth, we really drill down on different socioeconomic groups of people to look at the differences in outcomes, and more to come on that in a couple of weeks. One of my very favorite topics. A couple of other definitions that I like are explains and intervenes in the causes of systematic differences in health among different population groups. So looking at the underlying causes and then designing interventions to try to change those outcomes. A definition that we use in nursing is assessing the healthcare needs of a specific populations and making healthcare decisions for the population as a whole rather than individuals. And if you think about it, this is really a shift in thinking for us in the United States. We are very focused on the individual, the way our payment system is driven for the most part. Group health, of course, is an exception, but for the most part, we're very actuarial in our approach and really look more at the individual. And as a culture, of course, Americans think about the individual and what they want and their right to have all the bells and whistles, as opposed to what's really good in terms of outcomes for us as a population as a whole. Public health services affect people in a myriad of ways, of course, and they're often invisible. And folks in public health say, as we experience all the tremendous cuts that we've experienced in the state of Washington and across the U.S. over the past few years in public health services, we all say that that the public will only recognize how serious these cuts have been when there's a crisis and public health services that are not there become very visible, because for the most part they're invisible. It's based on organized community effort. It's aimed at health promotion and disease and injury prevention, and of course focuses on society as a whole, or the community that they serve. And what is the optimal health status for that community, and strives to provide programs and services that moves a community toward what is seen as optimal health status. When we talk about public health, it's difficult to talk about public health without talking about the 10 essential public health services, which were established about 20 years ago in 1994 through a steering committee for the American Public Health Association. And those 10 services start with monitoring the health status of the population as a whole to identify community health problems. And as, for example, chickenpox rates go up or something, to develop an intervention to hopefully get kids immunized. So monitoring that and responding is a big piece. Diagnosing and investigating health problems and health hazards in the community, informing and educating and empowering people about health issues. So public health is big on partnering with people to take charge of their own health. And then the fourth piece is mobilizing community partnerships to identify and solve health problems. And I think that the public health folks are really the kings and queens in partnering with services, agencies, programs, and so forth that are already in place to meet the needs of the community as a whole. So trying not to duplicate what's already in place. And then the fifth essential is to develop policies and plans that support individuals and community health efforts. When I think of public health, I always think about the large policy piece that they play in looking at laws, for example, that affect everyone, and just policies that protect us. Seatbelts, something as simple as that. Public health and many other organizations got behind making seatbelts a mandatory law in the U.S., but it's really in the interest of overall public health that came about. They do play a piece in enforcing laws and regulations that protect health and ensure safety. And they are great at linking people to needed personal health services and assuring that the provision of health care is there when it's otherwise unavailable. The Public Health Department now is getting out of the business of primary care and closing many of their clinics, but they're handing that off to Neighbor Care, for example, and forming partnerships with those folks to ensure that those services are still there for people. The eighth essential is to assure a competent public health and personal health care workforce. So looking at the standards of education around what people need to learn and know as a part of their education to become a competent public health nurse or professional. And the ninth essential is evaluating the effectiveness and accessibility and quality of personal and population-based care. So looking at those outcomes to evaluate how effective are the services that we're providing. Are they making a difference in terms of health across a population? And then the 10th and final one is research into innovative solutions for health problems. I think that has always been a strength of our own King County Public Health Department. And if you look at the literature, you will see that the nurses and physicians and others as a part of our own King County Public Health have secured many research grants over the years to implement and evaluate new programs. So why do we need public health? I know I don't need to convince this crowd, but we do need to think about it in terms of public interest because of, I think, all the cutbacks that have occurred over the last few years. A key element of public health services is to protect the population from threats to their health, epidemics, hazardous products, restaurant cleanliness, for example, clean water. There's a whole environmental division within public health. And we don't think about this too often, but public health does help us to maintain a productive workforce and to defend the nation. So it does help to keep us healthy as a nation. And if we think about health, good health, and services to achieve that as a human right, there's a social justice element to providing these kinds of services for people. There's also a piece of public health that addresses market failures that could fall through the cracks when you look at our medical system, our healthcare system. And a good example, I think, are STDs, in that quite often providers are not able to follow up on STDs as public health is. They don't have the clout to notify and treat sexual partners, for example. So I know I don't need to convince you all, but there are many really good functions of why we need public health services. Our public health system is organized on a federal, state, and local system. And I think sometimes we forget about the many, many agencies that are part of this huge system. Of course, at the federal level, there's CDC, HRSA, FDA, and so forth, that all serve to protect the public. State system, Washington State Department of Health, is more an overseer of services throughout the state, and there are a lot of uh, data that they are collecting to look at trends and so forth, and also what should we allocate money for in Congress in order to meet the needs of the population across the state of Washington. Where are the areas that are most at risk in terms of developing programs and services? But the actual delivery of services is on the county system. Now that's in Washington state. It really varies from state to state. Not every county in other states works like this. They might have a district level, or things might be more in the hands of the state if you have a very rural state and so forth. For example, I was in Virginia last spring, and it's not organized at all like the state of Washington. But our county system in King County is extremely active and has 5 divisions: community health, emergency medical, environmental health, jail health, and prevention. And interestingly, some years ago, I had a friend who was a nurse that worked at the county level and worked in the jails, and her whole job was to sweep through the jails and try to pick up women, pregnant women, who were in need of drug treatment and get them fast-tracked into drug treatment, because we know that pregnancy is a great time to convince someone that they need to get into a treatment program. There's some motivation there, and that was her job, and she knew more interesting clients through this job. And unfortunately, I think in terms of all the cutbacks, that position has been cut over the last few years. She did a really great job. Well, I would be remiss talking about public health if I didn't talk about the process that I think is prevalent across the U.S. for doing community assessments, and that is called MAP, Mobilizing for Action Through Planning and Partnership. And the diagram that you see here has the 4 areas for assessment in this tool, and then in the middle it outlines the steps that people go through for doing the assessment process. And there's 7 principles that are really integral to this kind of systems thinking. Well, it took 3 years to develop this, by the way, by representatives from all over the U.S. and several agencies and so forth. And so their thinking was that they wanted to promote an appreciation for the dynamic interrelationship of all components of the public health system, so that they could really develop a vision for a healthy community. So you'll see looking at community themes, strengths, and so forth, and then assessing the local public health system and what kinds of programs they're offering and so forth, and then the community health status assessment, and then the forces of change. What is coming that we need to integrate into our thinking, or what has happened over the last few years to change the health of this community and the services that are available. And then going through that 4-MAP assessment process, identifying those strategic issues that need to be addressed, and formulating goals and strategies, and then sort of like the hospital plan, do, act, evaluate. I'm probably getting those 4 steps wrong. Looking at implementing something and then evaluating what the program was. But the real important piece of this is that it's built on a foundation of partnerships and collaboration. And so that's why I said before that I think public health folks are really the